In this video, we'll describe the topic of tissue growth, death, and repair from Chapter 5 Notes over Histology. There's a few terms you should be familiar with here. The first is hypertrophy, and this is going to tell you whenever tissue growth occurs, but very specifically when it occurs due to individual cell growth. Skeletal muscle does this, where each individual skeletal muscle cell actually enlarges to accommodate for more storage and for more metabolic activity. And that in itself is going to cause the tissue as a whole to start to enlarge as the individual cells do that. The other form of tissue growth is facilitated through hyperplasia. With this, instead of each cell growing larger, they stay a relatively normal size, but they increase in number. So there's more rapid mitosis that takes place in these kinds of tissue. When you look at the pregnant uterus, that uterus starts out about the size of the palm of your hand and then grows so that it has enough capacity for a developing baby. So those cells within the uterus are undergoing mitosis, so the tissue itself undergoes hyperplasia. Now, for a lot of these, you'll see atrophy, and this is the third word down here, which is the opposite of growth. This is the shrinkage of a tissue due to a decrease in cell size or number. You do see this happen with age, and that's referred to as senile atrophy. But if you're looking at something like a skeletal muscle that used to be worked pretty heavily and now is not being used as much, that's referred to as disuse atrophy. Whenever tissue is damaged itself, there's two main ways that it can be repaired. And the first is with regeneration. And so this is ideal. This is where you have replacement of the dead cells by the exact same cells that existed before. So if you're replacing damaged cells with cells that are the same as the original, that means you typically have restored function completely. However, some tissues don't replace through regeneration. They have to go through fibrosis. And this is where they're replaced by scar tissue. Now, scar tissue is not as normally functioning as the original tissue. It's more just a band-aid to hold cells together within that tissue. You can watch a video over the 4 basic steps of tissue repair. And you should know these 4 steps here as written in the notes. Make sure you're familiar with each step, what takes place in each step, and all the bolded terms that are associated with it. So whenever you have damaged tissue, the first sign of tissue repair is actually inflammation. So all the swelling and the pain and the pressure and the bleeding, that's actually signs that your body is trying to repair the damage. So during the inflammatory response, and you can see this right over here, you actually end up with the hallmark hyperemia, as it's called. Now, hyperemia is itself just the increased blood flow that occurs following damage. This is usually stimulated through chemicals that are released by immune cells, such as mast cells, as well as the damaged tissue. Now, as blood flow increases to a site, all the good stuff in the blood comes along with it. So, for example, macrophages are immune cells that undergo phagocytosis, right? And they eliminate cellular debris or bacteria that could be present. Other immune cells and even antibodies that are coming from B cells, they're going to come along with this to try to initiate what we know as systemic immunity. So in case you end up with a virus that invades the body because of damaged tissue, this can prevent that virus from spreading all throughout the body. You'll also see clotting factors here so that you end up with positive feedback to stop blood loss. And then finally, as a part of all of this, you'll also see nutrients, oxygen, and growth factors that are going to help with the healing process later on. In step 2, you see the blood clot formation. So right over here, you can see that blood clot forming. And of course, the main purpose of this is to stop the loss of blood in itself. It also keeps the wound closed, so it acts a little bit like a barrier to prevent pathogens or further infection from getting into that site, or to even keep any kind of an invading organism that might have made it through from spreading to other parts of the body. In step 3, you finally begin to see healing start. So this takes a few days to get started. And of course, the healthier that you are, the better that this works. It has been shown that smoking, for example, actually prevents this from occurring the way that it should. But what you end up with is kind of an initial precursor tissue that fills in the space here, and that's called granulation tissue. Granulation tissue in itself is going to be really capillary rich, right? It's also going to have a lot of fibroblasts. And the job of fibroblasts are to lay down all kinds of fibers associated with the strength of the tissue, like collagen fibers. And so those fibroblasts begin to lay down new collagen. They actually eliminate the blood clot with the use of macrophages so that this begins to link those damaged regions of tissue together. At the very end, you would hope to see enough granulation tissue to form a nice basement membrane for epithelium so that regeneration can actually occur. So that epithelium itself would start to actually undergo mitosis. So you would see that form whatever kind of a layer was there before. Here in the skin, of course, you're seeing stratified squamous epithelium. And so it's undergoing mitosis to fill in those damaged regions. And you typically have a scab that covers this as it's occurring. So that scab stays on the top again to work a little bit like a Band-Aid and protect those fresh and underlying layers. You still see fibrosis take place, but if regeneration is occurring in the apical layers, it's typically fibrosis only in the more basement or connective tissue layers. It's only when you have really severe damage or a lack of nutrients that you would actually need to fill in all the way up to the top with a scar, and that would be complete fibrosis. Now, of course, tissue remodeling can occur for up to 2 years, so people might see an interesting indentation in their skin even after the scab falls away and it looks like it's been healed. Now, not all tissues repair in the same way. We find that epithelium, bone, and a lot of connective tissues regenerate really well. With smooth muscle and dense regular connective tissue of tendons, they regenerate moderately well, but oftentimes they don't regain complete function. And then, of course, you have cardiac muscle and most of your nervous tissue with virtually no regenerative capability. Again, with those tissues that can't regenerate, you still see healing and repair take place, but instead of replacing damaged tissue with the original functional form, you have complete fibrosis. This is one reason that an individual who has multiple small heart attacks can end up with a much larger heart attack later on, because following each heart attack that's small, they end up with fibrosis filling in those damaged regions. And the more fibrosis you see around the heart, the more likely you are to have a fatal cardiac episode. So, of course, we mentioned the fact that atrophy here is the shrinkage of tissue through loss in cell size or cell size or number, and that can be normal. That's a normal process. But when you see necrosis over here, that's pathologic. So usually that's due to trauma, toxins, infection. A couple of terms to see here is infarction. This is what you see happen with a heart attack, like we mentioned before. This is going to be necrosis of a tissue that occurs when blood supply is suddenly and completely cut off. This is also what you see happen with types of stroke in the brain. You could also see gangrene, and of course this is necrosis, but it results from insufficient blood supply that usually happens gradually. Now, because the tissue is dying pretty gradually, but it's not terminal, essentially, this opens up wounds like what you would see in the bottom of your feet with a diabetes mellitus patient, and that allows for better chance of infection. This is a decubitus ulcer. This is another type of gangrene. This is a bed sore. So individuals who are on their backs in beds for too long end up with diminished blood supply to those regions that the tailbone sits on and compresses. And so they can end up with bed sores like this that make them prone to infection. So again, make sure you know the steps of tissue repair and make sure you're familiar with the terminology of both cell and tissue growth as well as tissue death.